good everyone, welcome back to another Women's Health Action Trust Digi update. I'm Caitlin, our Digital Media Health Promotion Coordinator. I hope everyone is staying safe in their bubble. Today I have another video where I'll just be reading some information from the Ministry of Health, similar to how we did last week with the breastfeeding guidelines during Covid-19. We've got some information here for people who are pregnant or people who have recently given birth. So if you're in a really busy time right now or you haven't had a chance to come across this information, just feel free to let me read it to you. And I'm just going to be reading off the website, so it's probably best if you just listen podcast style. And yeah, I'll also link this below, so if you want to read it for yourself, you can check it out. So we've got some information here for pregnant women and people who have recently given birth. So if you are pregnant or caring for babies, it's understandable that you may be experiencing heightened levels of anxiety and distress while New Zealand is at COVID Alert Level 4. Now we're currently at Alert Level 4, we may be moving to Alert Level 3 soon. We do know that the healthcare system is going to be operating pretty similarly to how it is in Level 4 once we're in Level 3, so if you are pregnant right now, this is probably how it's going to be looking for some time to come, whether we are in level 3 as of next week or whether we stay in level 4. So this means that your plans about where you're going to give birth and who you will have for support may need to change. So your maternity care during pregnancy will also be affected. Your midwife or lead maternity care doctor will do as much as possible over the phone or via video calling. Your midwife may decrease the amount of face-to-face visits and will discuss with you the best place to have these. This is to protect you and your midwife from COVID-19 infection. Pregnant women do not appear to be any more susceptible to the consequences of COVID-19 infection than the general population. Your midwife or midwifery practice will adjust the way they work to reduce the spread of COVID-19. Before any visits with your midwife, you will be expected to confirm that you are well. If you are not well, the visit may be postponed or take place via a phone or video call. It is important to seek support where you can. This is usually possible through normal support structures like your antenatal classes, parenting education, or parenting support groups. As these are now postponed, try to keep in touch with your whānau and friends regularly by phone or online. It is important to take care of yourself, and that means taking care of your mental health as well. Face-to-face checkups. For most women, your face-to-face checkups may be reduced. Your midwife will still contact you by phone or by video call. You will be asked to attend checkups alone, which means no partners, family members, or children, and you will be required to observe strict hygiene measures, including physical distancing. The physical assessments, blood pressure and checking your baby's growth and heart rate, will still occur but will be done as quickly as possible. It's important you tell your midwife if you are unwell before any face-to-face visits. Self-isolation in pregnancy. If you are self-isolating due to potential exposure to COVID-19, you must tell your midwife or midwifery practice. It could be because of a close contact or if you meet the updated case definition for testing. If you are less than 37 weeks pregnant, your midwife or GP, obstetrician, LMC may reschedule routine antenatal visits once your 14-day self-isolation period ends. This will only happen if your midwife assesses that your maternity care can safely be deferred. If you do need a visit from your midwife, you will need to wear a surgical face mask. Your midwife will provide you with this, and your midwife may also wear some personal protective equipment like a mask themselves. If you are more than 37 weeks pregnant, your midwife will continue antenatal visits according to usual schedules. You will need to wear a surgical face mask during visits, and your midwife will provide you with one. Your midwife may also wear some personal protective equipment like a mask. Your midwife will talk about this with you in case you give birth during your 14-day self-isolation period. This will include local options for labour and birth and immediate postnatal care. If you develop symptoms of COVID-19 during your self-isolation period, call Healthline on 0800 358 5453 and follow their advice. You will be treated as positive for COVID-19 until you receive a negative test result. Healthline should be your first line of contact, then also let your midwife know if you do become unwell. Diagnosed with COVID-19 during pregnancy. If you have been diagnosed with COVID-19, a confirmed or probable case, inform your midwife or midwifery practice. If you are less than 37 weeks pregnant, your midwife may reschedule routine antenatal visits until you can be safely deferred. If you do need a visit from your midwife, you will need to wear a surgical face mask. Your midwife will provide you with this, and your midwife will wear full personal protection equipment, gloves, a surgical mask, a disposable apron, and eye protection. If you are more than 37 weeks pregnant, your midwife will continue antenatal visits according to the usual schedule. You will need to wear a full surgical face mask during the visit. Your midwife will provide you with this. Your midwife will wear full personal protection equipment, gloves, surgical mask, disposable apron, and eye protection. Your midwife will talk with you about options in case you give birth before being cleared of COVID-19. This will include local options for labour and birth and your immediate postnatal care. Care of older children during labour and birth. If you have older children, you will need to organise care for them when you go into labour. They must continue to follow the rules under Alert Level 4 and stay home. It is recommended you identify a trusted person who is part of your self-isolation group, and it is vital that this person is not elderly nor vulnerable, and that they and the people in their household do not have any other contacts other than people in your household. Maternity facilities, birthing or delivery suites in hospitals and birthing units in the community. Primary, secondary and tertiary maternity facilities will remain open to provide essential services during COVID Alert Level 4. If you are due to give birth over the next few weeks, check with your midwife about the service level available at your local maternity facility. Maternity facilities will have restrictions on the number of visitors and support people you can have with you at the facility. This includes while you are in labour and if you need to stay as an inpatient before the birth of your baby or afterwards. This is important to help stop the spread of COVID-19. Reducing the number of people in the facility will help protect you, your whānau, your newborn baby, other patients in the hospital, and the women's health staff looking after you. Some maternity facilities may need to limit the amount of time you can stay after your baby is born. Your midwife or DHB community midwife will visit you at home as required and keep in touch with you by phone or video call to ensure you and your baby are well. Your postnatal care during COVID-19 pandemic. For most women, your visits will be affected. Your midwife will do as much as possible over the phone or via video calling. Your midwife may decrease the amount of face-to-face visits and will discuss with you the best place to have these. Your midwife will ask that no one else is present during checkups, which means no partners, family members or children, and you will be required to observe strict hygiene measures including physical distancing. The physical assessments of you and your baby will still occur, but they will be done as quickly as possible. If you are self-isolating due to potential COVID-19, your midwife may reschedule routine postnatal visits. These will occur once your 14-day self-isolation period ends, but only if your midwife assesses that postnatal care can be safely deferred. If you do need a visit from your midwife, you will need to wear a surgical face mask. Your midwife will provide you with this. Your midwife may also wear some personal protective equipment like a mask. If you develop symptoms of COVID-19 during your self-isolation period, you will be treated as positive for COVID-19 until you receive a negative test result. If you develop symptoms, call Healthline on 0800 358 5453 and follow their advice. Healthline is your first point of contact, but you should also let your midwife know if you become unwell. If you are diagnosed with COVID-19, confirmed or probable, inform your midwife or midwifery practice. Your midwife may reschedule routine postnatal visits until you have been cleared. This will only occur if your midwife assesses that postnatal care can be safely deferred. If you do need a visit from your midwife, you will need to wear a full surgical face mask. Your midwife will provide you with this. Your midwife will wear full personal protection equipment, gloves, surgical mask, disposable apron, and eye protection during the visit. For more information, you can see their COVID-19 breastfeeding advice. So this is what the ministry has released in regards to people who are pregnant right now or might have a young baby. I think the most important takeaway there is that there are still options for you to see your midwife, and you will still be being in touch with your midwife during Alert Level 3 and 4, but that care may look a little bit different for some time to come. And if you do become unwell with COVID-19, there are still options for your midwife to visit you if you do need it. So everyone will still be looked after. Now there's more information on the ministry website, as I said, so that'll be linked with this video too, and you can go and check that out for yourself. And in the meantime, we hope you stay safe, and we will see you in another video shortly. Thanks for watching.